Hi, Alex. Thank you for joining us to talk about student health insurance. Because when I moved to Germany as a student, it was so overwhelming. I couldn't figure out what is private health insurance, public insurance, travel insurance. There's so many kinds, right? I was so confused, and we go about and start with the first question.
Okay, thank you so much for having me today. Let's do it.
Is it true that international students get free health insurance just like German students?
It's funny, it's actually not even always free for German students either. In general, the free health insurance is usually the family insurance policy in the public or statutory health insurance system in Germany. So, in a family, kids can be co insured with their parents, yeah, without an extra cost. But for those people, it also ends at 25 years of age, and they have to take out their own student insurance. And for international students, they don't normally have a family insurance going on. So they just arrive and have to get their health insurance, either in the public or in the private system.
I already have travel insurance. Can I just use that?
Yeah, it's great that you do. It's perfect. It covers you for this first time of your arrival, this transition period. But in Germany, there are local insurance laws, and the German health insurance is obligatory from the time that you are starting to reside here and also your university study starts. Yeah. So normally, travel insurance covers you before your enrollment and study start. And from then, you have a German health insurance. You need to decide is it going to be public or private, and then get one and give this info to your university that you now have a comprehensive German correct insurance. Then you can also use it for your residence permit application to turn your visa into a student residence permit card, etc.
Now that we know that, what is the best health insurance for students in Germany?
That's a good question. I think it's very individual for whom which system works better. They're just different. But generally, the public insurance is more the default system. For example, it's actually mandatory for students under 30 years of age to go there. They can, in the first 3 months, in the very beginning of their study, choose a private insurance and step out of this obligation. But most people in Germany have public insurance. It is very limited in coverage. That is kind of the drawback of being universal because they cannot guarantee everyone really great dental care and access to private clinics and everything like that. So they have to cut corners here and there. A lot of the time, you have a longer waiting time to get an appointment, but the public insurance is there and exists. The private insurance, you have to kind of research this a little bit more. Private insurance can be taken out by a student under 30 years of age within the first 3 months of their study. And then they can just stay there until the end of their study, right? It does cover more. Normally, it includes the mandatory coverage, like the public insurance, but also covers dental services, access to private clinics, better hospitalization conditions, things that used to be covered in the public insurance more, but now have been kind of limited, like glasses and contact lenses. Private insurance includes. Often, if the person is young and healthy, that age and health are the basis for cost calculation in private. The private policy can also cost less than public. So it really depends on the person's age, on their health, on their needs, what kind of person they are, where they end up, and what fits them better ultimately.
Oh, nice. Sounds like private health insurance just covers more. But I've also heard that it's super expensive for students. Is that true?
No, it's a common misconception that private insurance, because it covers you more, must also therefore be more expensive than the public insurance. It's not always the case. And the private insurance is based on the age and health history of the person entering a specific plan at the time of them joining. And so, for a young and healthy person, it can be very, very affordable and still include really nice coverage. It's also important to think about what you get for the price that you're paying. In the public insurance, the prices are actually created based on BAföG amount, the stipend that people get in Germany as a student mostly. And it is kind of subsidized. It's made lower than it could be. because it's for students. Yeah. However, you still need dental care and you still need to clean your teeth professionally every year, which is if covered only partly or not covered by the public insurance at all. It also costs you maybe around 100 or more euros, depending on where you are in Germany. So there are dental or medical services that you will end up paying out of pocket, even though you're paying for public health insurance. There is even special insurance types in Germany to top up the lacking coverage of the public insurance that also cost extra per month if you want to have them. So, with a private insurance, for a cost that's either comparable or even lower than public insurance, you also get all those services covered. Whereas there's a lot of value in coverage, and that's something also you need to think of. Maybe it's a good idea to just talk to your friends or somebody you know in Germany, maybe somebody at the university about how healthcare is and what things they get covered and what they wish they had covered. So you gain a bit of an understanding.
Ah, that sounds nice. But how much does the private health insurance cost for students in Germany?
Well, a student can take out private insurance either if they're over 30 when they're starting the study, or when they're under 30 years of age, but they're at the beginning of their study in the first 3 months. Yeah. If a student's under 30, and for example, just 18, 19, starting the first study, they're so young that they're likely to have a cost maybe around 110 euros, 120. At ottonova, the rates would start at around 110 euros, which is less than the current public premium for students under 30. And after 30 years of age, the public insurance doesn't have a student plan anymore. It's not possible to continue at the same rate per month. And they just assign a fictitious income, minimal income, and calculate the new cost based on that, as if a person is minimum non-student earner. And that can be around 250 or more euros per month already. And if you're healthy, even though you're over 30 years of age, in the private system, you can still have a lower cost than that with better services. So it's very much worth it to analyze what your needs are, what is your situation, get an offer, and see what fits you better.
Ah, that sounds really nice. But in your opinion, what are the advantages of private health insurance compared to public health insurance?
Well, if we just put the savings perspective aside, even though you're saving, there's also things that you use about your health insurance. How quickly can you get to a doctor if you need to? What if it's a specialist? In Germany, a lot of the time in the public system, to get to a specialist doctor might take some time, weeks maybe, or months. Whereas in the private insurance, you can go to more doctors in general. So you can contact more and get an appointment quicker. And, for example, ottonova can even find you a doctor. It's an app. You can just request a doctor there, and then you get much better support, maybe even from an English speaking doctor. So that also counts. That's something valuable. As a student, you have a lot to stress about. You don't want to be stressing about finding a pulmonologist in a new city. To stay healthy, it's important to do preventative checkups, dental cleanings, skin cancer checkups, things like this. And it's a lot easier with the private insurance. With Ottonova, there are no age limitations. The public insurance might have age limitations and not let you do all of the checkups right away. But the private insurance is interested in you staying healthy. So you can go to all of them much earlier, easier because you can go to a private clinic and make this appointment quickly. And Ottonova really supports you staying healthy, which is also important. Maybe for an international student, it's also important that the insurance covers you not only in Germany. So Ottonova can cover you all over European Economic Area and also worldwide up to 6 months per year. With health insurance obligation in Germany also comes a lot of paperwork usually. A private insurance like Ottonova can rid you of that, or at least save you some of the stress because it's fully digital. Everything happens in an app. It's easy for you. It's in English. And even if you have a question, you can always just ask it in the chat and get something clarified right away. So it's easier to use.
Oh, wow, I really didn't know that. But what happens once I graduate and want to stay in Germany and work? Will it become more expensive?
Well, it really depends on what happens after the study is over. There are several scenarios. If you move away, it's very easy. Your private insurance can just stop because you're not residing in Germany anymore. But if you're staying for a while, your student plan will just continue because you still have to be covered and your previous insurance covers you. But as soon as you have a change of status to, for example, working, it depends on your income. Very often, even a part time job, which is more than a mini job level, places an obligation for people to be in the public insurance as an employee. And from certain income threshold will be 77,400 euros. Private insurance becomes also available for employees. So if you start a job over that income limit, the public insurance will not place an obligation on you, and you can just continue with your private provider in a plan for employees or freelancers that you choose. Also, if a student starts freelance, for example, after their studies, they are not obliged to go to public insurance. They can also continue with their private provider, but then just see what kinds of plans the insurance has for you. For international professionals, people on a work permit or a freelancer permit, often there are so called expat tariffs available that might be also interesting. And they do cost less compared to normal long term plans for the country. Generally, if you have any type of status change, if you're finishing your studies, you can always just contact the ottonova concierge team through the app, give them a chat or call them, and they can see if there's any change needed and what options you have.
I see. So you need to earn above a certain threshold to continue being in private health insurance, right? Let's say I don't. How would you move to public health insurance? Is it easy? Is it easy for students? What is the procedure?
Yeah, this is a very easy process, I would say, because the public insurance has no health assessment to join. It's just calculated based on your status and income. And even your employer can put you into the statutory insurance system. Very often, you can just talk to your HR and then they can just organize it for you. And then once you already have the insurance certificate or the proof of public health insurance, you can just show it to your private insurer, explain that you're having a status change, you already have the public one, and it's very easy to just stop the private insurance then. You can contact any public health insurance yourself. You get the choice which one you want to go to. There are minimal differences between them. You can research yourself and choose one and contact them. Or if you want to save some time and you don't really care for the differences, you can just ask your HR to organize you one.